morning, Robert.
Hi, Bill. Hi, everybody. Welcome to our video series, People Who Make a Difference. I'm Robert Simmons, and this is my friend and personal physician, Dr. Bill Warnock of the Champlain Center for Natural Medicine in Shelburne, Vermont. And we've been making some videos specifically oriented towards supplements and the 5 supplements that Bill recommends most universally to his patients. So today it's, which one is it today?
Magnesium.
All right. Well, let's get into it. Tell people what magnesium is all about.
Well, magnesium, of course, is a mineral that our body requires. In fact, are over 300 metabolic processes that need magnesium.
Mm-hmm.
So that's a good share of what goes on within the cell in the body. And one study estimated that half of the population in the United States is deficient in magnesium.
Wow. Half.
Half.
So we'll go on. Tell us more.
Magnesium, of course, is the main ingredient in chlorophyll, and people who eat more leafy green vegetables are going to get a higher amount of magnesium. So unfortunately, that's what most people don't eat a lot of.
Right. It seems like every study I see about diet says leafy green vegetables.
That's right. But, people just, never really have been attracted to leafy green vegetables, probably going back to our hunter-gatherer ancestors,
Mm-hmm.
But regardless of that, magnesium as a supplement comes in various forms. So you've got magnesium sulfate, magnesium glycinate, citrate. There's about a dozen forms of magnesium. In fact, some of the forms of magnesium are common. People don't even know that they're taking them, like milk of magnesium.
I was going to ask about that.
It's a laxative. That's magnesium carbonate. And the reason it's a laxative because only about 5% of it's absorbed, but it stays in the large intestines, pulls water in, and becomes a laxative.
Oh, I see. Wow.
And Epsom salts.
Right? That's a magnesium salt, yeah?
Magnesium sulfate, yeah.
Okay.
And that can be used as a laxative as well because it's poorly absorbed. But in the form of a bath, it's absorbed enough through the skin that has been shown to raise blood levels of magnesium. And in that form, it really doesn't cause any kind of diarrhea because it's not taken in through the intestines.
Right.
So everybody knows you throw Epsom salts in the bath to help your muscles relax.
Yeah.
And that's one of the primary effects of magnesium is to relax muscles.
Okay. Yeah, I won't get ahead of you on this, but I know I take it for that.
Exactly. So if a person's having muscle cramps at night, magnesium can help with that, for example. The heart as a muscle also uses magnesium. So when a person's having heart palpitations or irregular heartbeats, sometimes magnesium can help with that.
Oh.
In a highly absorbable form, so you get a high enough blood level without having loose stools. And there's several really highly absorbable forms, but the 2 that I recommend the most are citrate, magnesium citrate, and magnesium glycinate.
I think I take that one, the magnesium glycinate.
Right. So it's bound with glycine, which is a semi-essential amino acid. And the muscles also use glycine to help with their metabolism, and it helps them relax. So you get kind of a dual process going on when you take the magnesium glycinate. Magnesium citrate, on the other hand, the citric acid in that can help with kidney stones.
Oh. You mean dissolving them or preventing them or both?
Help to prevent them.
Mm-hmm.
because that citric acid in an acid environment, those kidney stones don't form as well. So, the different forms of magnesium can be used in different ways.
Is the magnesium citrate also one that isn't prone to give you loose stools?
Exactly. So both the glycinate and the citrate are absorbed in the mid 90% range.
Mm-hmm.
But still, if you take enough of them, you will get loose stools. So when a person takes any form of magnesium, I always say don't go past the point of having loose stools.
Right.
But in that sense, too, a lot of people have constipation, and magnesium can be a help for that.
Mm-hmm. And are all of these reasons the reasons why you consider it one of the top 5 supplements for people?
Well, that and quite a few more.
Oh,
actually. I mean, we've just touched the surface of magnesium. In regard to relaxing muscles, I'd like to interject calcium in here a little bit.
mm-hmm.
So your body uses calcium to contract muscles, including large blood vessels and the heart.
Mm-hmm.
So one of the types of medicines for blood pressure is a calcium channel blocker. It keeps that calcium from contracting those large blood vessels and the blood pressure drops. Well, magnesium has been shown to be helpful for reducing hypertension or high blood pressure as well, because it helps to relax those muscles. Magnesium is needed to have healthy bones, but it works, you can't say really antagonistically towards calcium in this regard, but synergistically with calcium. There's been no study that's ever shown that calcium supplementation helps to make stronger bones. And the reason for that is basically that calcium is controlled very tightly by a whole series of hormones and enzymes in the body. So no matter how much you take, you're not going to really increase the calcium supply to the bones unless you're really calcium deficient. Most people aren't. You'd have to really design a calcium deficient diet for most people.
I see. So they don't really need it in pills, you're saying?
Right. In fact, one study out of Sweden, and it's one of a number of recent studies that show that high amounts of calcium can actually increase cardiovascular risk. And the reason for that is that plaques, which block the arteries, are 1/3 calcium.
Right.
And when you take a high amount, it circulates in the blood before it's excreted through the kidneys. So when it's excreted through the kidneys, it causes a higher risk of kidney stones, but when it's in the blood, it actually causes greater plaque formation. In fact, that study I'm talking about out of Sweden showed that women over a 5-year period who took 1,000 milligrams of calcium had no benefit with bone fractures and had a 3 times higher rate of cardiovascular deaths.
Oh, wow. So is it appropriate for me to say then how it is that magnesium fits into this picture vis-a-vis calcium?
Well, what
I
we
mean,
can
you have
say,
said something about it.
It balances calcium out, and the process of putting calcium in the bones requires magnesium.
Oh, I see. So that's the synergy you're talking about.
Right.
I got it.
So I do not recommend calcium as a supplement.
Right, because you get enough in your diet and it's too easy to have too much.
Exactly.
Got it.
And there's been no study that's shown that it really helps with strengthening bones.
Mm-hmm.
But a lot of patients come in taking a calcium magnesium supplement, which I usually tell them that's not the best thing. Just take a straight magnesium supplement.
Right, because you said half the population is magnesium deficient, whereas everybody's got plenty of calcium just from their food.
Exactly.
Yeah.
one of the medically recognized uses of magnesium is for the treatment of migraines. Um, and when a person comes to see me, that's always one of the first things I put them on. In fact, what I've seen in our office is that if a person has an acute migraine and they get an IV of magnesium, it can really get rid of that migraine quickly.
Wow. So is that something you do in your office?
Yes.
Mm-hmm.
So what else does magnesium do? You have any ideas?
Oh, I mean, I know that it helped me a lot with the cramps I got at night. I really have gotten rid of them since I started taking magnesium, although I had to find my right dosage because it seemed like when I took too much, I was getting cramps on that end.
Right. So I'm glad you brought that up because I've seen that many times. And if a person takes magnesium at a high dose for too long and their body becomes oversaturated with it, then a person can develop cramps as well.
But I will say that all I had to do was drop my dose and they went away almost immediately. And then I found the dose that I can take every day, and I'm good.
That's great. And if we look at the diseases, the chronic diseases that most people will contract during their life, or the highest number of people will contract during their life, it's cardiovascular disease. So magnesium's been shown to reduce death by cardiovascular disease by quite a bit, actually. Diabetes, magnesium shown to be quite helpful in preventing diabetes, and once a person is diabetic, to prevent some of the comorbidities or the effects that the negative effects that diabetes has on the body.
Oh, I see.
So if we just look at those two aspects, magnesium becomes really important. You can see why I've named it the fifth most important supplement to take.
Yeah, no, I learned more about it. I mean, I've been taking it for years because of you, but several things you said I hadn't heard of before. And one thing, I mean, just to stress it, diabetes and heart disease are huge problems in the United States and probably all over the world. And for a simple thing like a supplement to make such a difference in that, that's a big deal to let people know.
Exactly. And a lot of doctors resist their patients taking supplements, or they tell them, oh, you're just wasting your money. They're being flushed down the toilet. Well, these 5 supplements have been shown in numerous studies to be helpful. They're non-toxic. You can take too much of anything, of course, so too much will cause side effects in any of these 5 supplements I named. But generally, they are safe and they can be effective in preventing disease and helping a person stay healthier during their entire life.
Oh, that's awesome. Well, tell them one more time what the 5 supplements are before we finish.
Top of the list is...
Oh, come on, you do it. I forgot.
This is a test.
This is a test. Well, let's see. Fish oil was one, but it wasn't the top of the list, meaning EPA, DHA, and iodine. That was number 4. And, geez, what one do you have for forgetfulness, Bill?
Vitamin D.
That's the first one.
Vitamin D was at the top of the list. And remember that vitamin D affects at least 7,000 of our 35,000 genes in a positive way.
Right. So, okay, run them down then.
Number 2 was vitamin C.
That's right. Linus Pauling. How could I forget?
Exactly. And even though we do get vitamin C from our diet, it's not enough to meet all the requirements that our body has for vitamin C. So by meeting those requirements, a person will be healthier in many ways that we outlined in that discussion.
Right. And then number 3, was that EPA, DHA fish oil?
Exactly. So that was omega-3 fatty acids. Looking at it primarily for cardiovascular disease, but it has positive effects on other things like diabetes.
Yeah, and then there's iodine, which we just talked about.
Which we talked about, and that has its primary effect on the thyroid, but also on hormones to lower rates of certain types of cancers, and on digestion.
And of course, magnesium, that's this video. So if people want to contact you in your practice, that's the Champlain Center for Natural Medicine in Shelburne, Vermont, right?
Yes.
Okay. I recommend it, everybody. It's done me a lot of good. Thanks for being on the show, Bill.
Well, thanks for inviting me.
I hope we do it again.
Me too.
All right. Thanks.